Thanks so much. All right, so I'll do the last talk, which will just be for 5 minutes, and then we'll have time for questions and discussion. And mine will really be get this the role of the hub PI. So just sort of what it looks like for a boots on the ground person. You've seen this map before, so I won't spend time on it, other than to highlight that there's, for those of you who aren't as inside the system, there's the funded hubs, but there are multiple other sites that function as hubs within the network that aren't on this map. So there's a lot of different places. If you are looking for a hub to work with, there's plenty of options. So approach any of us, and we can talk about what would be good options. But there's a lot of different places that are great hubs that just aren't as a matter of technicality on that map. So what do the hub PIs do? And their missions really are, first, operations enrollment at the hub. So part of the SIREN grant is each hub has made a commitment to participate in each trial unless there's a specific reason not to. So Hobbit has a bit of a unique design. But then your mission is to help it be building the right spoke network for each trial. And each trial, of course, has its unique issues. For example, Boost 3, that part of the mission is you have to be able to do cerebral oxygen monitoring. And so part of the hub's job is to reach out. What are the other sites that could be doing this and build the network? And help with assisting with clinical trial operations at the spokes. So I'll talk a little bit more about that, but that is also a very flexible process, as Bill talked about before. Some spokes need different kinds of resources from the hubs than others. And then last, of course, bringing great ideas into SIREN. So what do you do when you're coordinating with the spokes? So there's some spokes that are really running an independent research operation, and they don't need that much help. It's really more of a collaboration model. And that's frankly what we have for many of our New England sites. It's really more of a collaboration than sort of a boss and an employee kind of model. So in that case, there are hospitals that have very good research operation, and in there, really the hub is coordinating efforts, helping with maybe some administrative back-end operations. You know, there's a lot of regulatory documents that instead of having 5 different hospitals independently learn how to do it, you could have one administrative team at the hub who really knows that regulatory stuff and can sort of help the spokes do it and leverage some of that work. Develop standard operating procedures, and how do you train all your providers? And instead of having your own hospital, your own spoke, building this all yourself, you've got somebody nearby, a local person working with you to say, hey, here's the SOP at these other 5 hospitals that are right in the same town, that let's just use those. Now, there's also some spokes use more of the hub infrastructure. There are some places where there might be, the spokes might be a community hospital that you want the hub research team to come there, for example, and enroll the patient at the hub. And so there are many places that have the hub as a research team that goes to local spokes, does the enrollment, does the paperwork, does the regulatory documentation, and there your spoke is really a location, a supportive environment, but they're not managing their own research infrastructure. They're counting on the hub team to do it. And so the hub team can go there for patient enrollment, trial management, patient follow-up. You can imagine a hub and spoke system where maybe each spoke enrolls patients, but you have a centralized system for follow-up and a centralized team that manages following up with the patients enrolled. So ultimately the role is to work with each spoke. What are their needs? What's the level of involvement? What's the right interaction for you guys to work with? So any of you who are interested in being in SIREN and don't know how, a great idea is go to any hub that you think would work well for you, or go to any hub, and we can all, we're happy to even send you to what's a good hub for you, and say, here's our situation, we'd like to participate, and it's very easy to come up with what's the right model and what's the right level of support you need, and how can the hub provide that. The hub team's goal is to be a local resource to coordinate spokes, support research efforts, and build the team. And then last, I want to comment that, and what I hope maybe we have some discussion here on, is how do you build awesome trial ideas for SIREN? Ancillary studies and clinical trial. Maybe you have your own awesome idea for a study, and so what's the easiest way? You can simply contact the SIREN team directly, but it might be a nice opportunity to work with a local team of hubs and spokes to help flesh it out, to get some great ideas and build your trial up, and or even that you don't necessarily have a great idea, but you'd like to, and maybe it's a great your hub and spoke team can meet and have some discussions. Let's build some great ideas to bring to the network. So I think the hub PI's job also is really to try to be bringing good ideas to the network. And I think that was all I had. So I will stop there. Thank you very much.